useful event, all to do with health. And we have with us our experts, Dr. Varkha Lakshman and Geeta Seth, who are both experts and will guide us in the right manner. Today, our topic is acid reflux. Sometimes it's also known as the gastroesophageal reflux disease or GERD. It is a condition in which the stomach acid this is a condition in which the stomach acid flows back into the esophagus, causing symptoms such as heartburn, chest pain, and difficulty swallowing. We often identify this as acidity. And many a time we get very disturbed by it, by things we eat, or maybe by the lifestyle we follow. So here today we have with us Geeta Seth, who is a nutritionist and a dietitian. She's a qualified nutritionist for the last over 15 years, a two-time gold medalist in the field of nutrition. She's also a qualified diabetes educator and diabetes pump trainer, specializing in diabetes. She claims to have a normal blood glucose in diabetes with the right diet to avoid diabetes complications further. So as a speaker, she has given nutritional services to various corporate institutes, schools, and also individuals. Welcome, Geeta.
Thank you.
We also have Dr. Varkha Lakshman. Dr. Varkha is a general practitioner at RSU Bunda Hospital. She graduated from Atmajaya University and has been practicing medicine since 1996. She also has a diploma in family medicine and is an international member of the Royal College of Physicians. So we have the best two people here with us to guide us. Welcome, Dr. Varkha and Dr. Geeta. Welcome.
Thank you so much. Thank you.
Thank you.
Yeah, so maybe I can ask a question of both of you, and maybe I can start with you, Geeta. What is acid reflux?
Okay, so let's talk something very simple on a layman's language. What is acidity? The stomach, the inside of our stomach produces hydrochloric acid every day. Do you know it produces up to 1.5 liters every single day? And what is the use of this acid? It digests our food completely, and it's very, very important for us. If you say, oh, I don't have acid, that means you can't digest your food. So that is impossible. Acid is a very, very important part of digestion and our body. So acidity means when either your stomach is giving too much of acids, producing too much of acids, or you have not eaten your food in time, but the acids are still producing. You know, the smell of food. What happens when the smell of food is there, good food, suddenly the acid starts secreting because it wants food. And if you don't give it, and suppose if you have eaten anything which has got lots of chili, and you know, if you talk about diet, then lots of fried stuff, etc., then the acids come. So here, if you don't feed your stomach with the right food, acidity happens. So acidity is the backward, upward going of the acid of the stomach in your esophagus.
Right.
That is
so
called
that
acidity.
Is from the nutrition point of view from Geeta. Dr. Varkha, what is your point of view on what is acidity?
Right. So I agree with what Dr. Geeta says. So our stomach lining has got a lot of cells that produces this acid, which is controlled by our hormone, which we call as gastrin, and by a lot of complicated nervous system. So this nervous system is like a signal that gives to the stomach, okay, you need to produce more. Oh no, you have to stop producing your acid. And this is a complicated system. So when there are various reasons which Geeta has mentioned that can cause an increased production of the acid. So an increased production or a decreased production of the acid both is actually not good for our system. And when there is an increased acid, so acid supposedly to be in your stomach, and it should not go up your windpipe because there is like a clamp which is made of muscles that prevents the acid to go up your windpipe.
Right.
And besides that, you know, there's also your, you know, your lung, below your lung, there's what we call as a diaphragma that's made of muscles. that also prevents your acid from going up to your windpipe.
Right.
Yeah. So when this acid from your stomach goes up to your windpipe, that's what we call as an acid reflux.
Right. So is this a serious condition?
So sorry.
No, so my question to you, Dr. Varkha, is this a serious question? Is this a serious condition?
So it depends. You know, every one of us will have experienced this backflow of the acid once in a while. You know, so if it is once in a while, you know, that's not a problem. But if it happens constantly, if the acid constantly goes up to your food pipe, yes, it can cause a problem because it can irritate the lining of the windpipe. And it can cause a lot of issues. You know, it can cause inflammation in these cells, and it can also irritate the blood vessels that are in the lining, which can also cause these bleeding. And you know, if you don't take care of that at that particular point, then it will constantly erode the lining of your stomach, and it can even cause an ulcer.
Right.
So yeah, if it happens constantly, yes, it can be harmful.
So are there any tests required to determine what is the extent of your acidity or your situation? Does the doctor say, go get this test done for acidity?
No, ideally, there are some tests that is being done, but ideally the diagnosis that you for this reflux is based on your symptoms.
Okay.
So
no specific tests are required to determine whether you have acidity or not.
At the initial phase, no. The diagnosis is based on symptoms. But at a later phase, there are a couple of tests that can be done, you know, if the symptoms are not getting better.
Sometimes when we have, you know, acidity also leads to heartburn. That's why it's called chest pain. How do you determine it is because of acidity and not because of a heart problem?
Yeah, that's a good question. It's extremely difficult for a layman to differentiate it. Usually this symptoms of acidity can be a lot. Yeah, so symptoms of acidity can be from the heartburn that's in the center of your chest, or it can cause an irritation in your throat, or it can even cause, you know, you feel something stuck in your throat. It can cause nausea, it can cause vomiting, it can cause decreased appetite, it can cause diarrhea. So there are many symptoms, and the most worrisome is with the chest pain. Totally agree. So there is a 5% chance that you know, the chest pain can mimic like a reflux. So the best thing is, you know, like we need to know when it occurs. You know, if it has occurred after you have eaten a food, you know, then you can have a high prevalence that it can be, you know, it can be reflux. And plus, you know, like when you come to the doctors, you know, like we will determine your risk factors. You know, do you have a high risk factor for a heart issue, or do you have, you know, or the risk factor is more towards a reflux? So that's the reason why we usually have to take a lot of history from you to be able to differentiate them. But in this 5% cases, you know, we have no choice but to do an ECG. So if in doubt, best to do an ECG.
Correct. Does medication help in acidity, acid reflux, or heartburn like this?
I'm sure 90% of the people in this room right now has this acid medication in their room or in their house, I would say. You know, some people would have the Eno, the antacids, you know, the H2 blockers like the Rentin, the proton pump inhibitors, the omeprazole, the, you know, like pantoprazole, name it. 90% of my patients have these medicines at home. You know, so medications treat the symptoms. It reduces the acid depending on, you know, like what we are facing. So as physicians, with the numbers of medications that's available, we make the choice of the medication to prescribe to a particular person depending on the severity of the symptoms. depending on the complications, depending on the duration they have experienced, depending on what is the main issue that the person is facing.
Right.
So, like despite all the numbers of medications, we have to individualize the treatment. However, this treatment is just symptom relief. It's not treating the cause.
Right.
Yeah, so you will constantly have this, but this is, again, the easiest solution. Yeah, so everybody in this era don't want to wait a long time, and they don't like to make changes.
Right.
So they go to the doctors, get medications because it's an instant relief. That's what they want.
Yeah.
But without realizing that this is just temporary, because if you don't treat the root, the symptoms will keep coming back. You'll constantly have the symptoms. It will get better for about 2-3 months. It will come back. So the root is to take care of the cause, and the cause, the root is actually your lifestyle.
And that's what Geeta is going to tell us, soon. But before we go to Dr. Geeta, Dr. Varkha, my question to you is, most of the medicines that you just mentioned, like ranitidine, omeprazole, all the antacids, these are all available over the counter.
That's right.
So are there any side effects to popping these medicines?
Oh, yes, there are. There are. In fact, in the recent study, I went to the recent continuing medical education for family medicine in US, and just October of 2022. And this was the recent study that they have identified that with this proton pump inhibitors, when taken long-term, more than 2 years, can actually cause a cancer.
Oh, gosh.
Yes. So you want to switch it.
Worse than the disease.
The hard part with patients is, especially with this acidity issue, because nobody likes to change their lifestyle. So
Right.
they jump doctors to doctors to doctors to doctors. They keep, jumping from one doctor to the other doctor. So we have no records. How long have you been taking this medication for? So a lot of the times we miss this, so yes, the acid itself can cause cancer because of the constant irritation and the changes that it causes to the cells. But the medication itself, when used on long term, can cause cancer.
Right.
And plus, if we go to the basic, so this acid is actually required to digest your food. And if we are using this medication to reduce the acid, it doesn't kill off the bacteria as well. So there can be bacterial overgrowth as a result. So medications do have complications as well. So yes, just ideally you want to do lifestyle change, which is the number one. Yeah. And if you need to be on medications, please discuss with your provider and let them know how long you have been on these medications and what have you taken so far.
Right. So last question for you, Dr. Varkha. If somebody had to consult a medical professional regarding acidity or the problems they are facing, who do you suggest they should go to? Should they go to an internist, a gastroenterologist, or somebody else? Who do you think they should go to?
So the best person is the person they feel comfortable with. Yeah. So if they have an internist they feel comfortable with, yes. If they have a general practitioner they feel comfortable with, yes. If they have a family practitioner, yes. So I would start with the primary medical care first. And because the primary medical care will be able to assist them to change their lifestyle.
Right.
So besides medication, we should work hand in hand to changing the lifestyle.
Yes.
If we fail to do that in the primary care, that's when we refer to a gastroenterologist.
Correct.
And the reason why we want to refer to the gastroenterologist is basically to do further testing to see how deep the inflammation has been triggered. Why is the medication not having an effect? Is there a bacteria that's triggering it? So that's when an endoscopy, a more invasive assessment needs to be done. You can do an endoscopy. They can do a gastroesophageal pH testing.
Right.
So there are many testing that can be done by the specialist, yes, but you don't jump directly to that because nonetheless, even if you've done that, again, the basic is to change your lifestyle.
Correct.
Which is very hard for people to accept nowadays.
Thank you, Dr. Varkha. That was really informative and very clear, and your directions are spot on, and all of them guide us to Geeta. So, Geeta, we have Dr. Varkha has guided us directly to you about lifestyle changes being the best way to manage acidity or acid reflux or GERD. So, Geeta, tell
Thank
us
you,
what.
Doctor. Thank you, Dr. Varkha, for nice information you have given all of us on your medical part. So I would like to tell you all here, 95% of the clients we have, the patients we have, once they change the lifestyle, they don't require an antacid also. So basically acidity is actually a lifestyle, I mean, it's a lifestyle condition. How we all do that morning we have eaten a good breakfast, and then for lunch we have eaten something sour also, and for dinner I'm going to have my mutton. Oh, definitely you'll have acidity. And plus, if I have slept late, I have eaten late, then you are done. Then you are done. You will definitely come back with acidity today or tomorrow. Ideally, as we know that people who have a lot of acidity, they are going for endoscopy. They go for even different tests, as Dr. Varkha must be knowing. The pH monitoring device is sometimes inserted in your esophagus to determine how much acid you're secreting. But believe me, all the acid secretion depends only on the food. Only on the food. 95% of my clients are all okay, only with lifestyle and food disease. So number one is you should not be obese. When a person is obese, then he can have even hiatus hernia, which is a different thing, not an acidity. But when you have acidity, then this comes up. What happens? The sphincter, as you said, on the esophagus, it opens when the food goes inside, then it closes. Now, what happens in acidity? That it opens and the acid goes up. So when you have this chest burning, so many people think that they have a heart problem. They do go for an ECG because nobody wants to risk it. But believe me, it is a very small chance that they have a heart problem. And anyway, when the acid travels still up on the upper side, then you can have choking, coughing, and the constant coughing is there, choking is there, then you cannot help yourself. At that time, at that junction of time, we like to give them something which can actually, better the acidity temporarily. So milk is a very good medium where I give my herbal milks with different additions. Ideally, milk is a base where your acid goes low. Of course, not forever. Forever, if you want, then you require a lifestyle. You need to have a lifestyle change, which generally we don't have. For example, I like to add chia seeds in the milk. When the chia seeds they go in the stomach, they soak like a sponge the acids, extra acids, and they go away. So this is a very, very important. I mean, these are the like how you have antacids at home. Same way, you should have cold milk with chia seeds at home. They should be kept if you're eating out or if your acids have
Geeta,
gone up a
I'd
lot,
like to
etc.
stop you here and ask you, what about people who are lactose intolerant?
Yes, when they are lactose intolerant, then we give them coconut milk.
So
Now,
coconut
oats
milk has
milk,
antacid properties similar to regular dairy milk?
no, it has got lactose. Lactose is a sugar which is only in the normal milk, which is given by the cow or which is Tetra Pak. That is different. So we give them sometimes we give them coconut milk, sometimes we give them rice milk, which is rice milk is absolutely not good in taste, definitely. And then we give them chia seeds also.
Okay.
If at all the person does not want to have anything, then we give them chia seeds. Simple. It should be given cold. So this initially helps, and then we see the lifestyle of the person. We like to stop the tomatoes and the tomato purees and tomato sauces. They actually create acidity. I mean, they aggravate it. They aggravate it a lot. And then fried, because obesity and fried food are directly linked with the acidity. Directly, the moment you lose 5 kilos, your acidity will go less. And because this, it gives pressure to your all muscles in the stomach and everything, and then the acidity increases. And as we said that, yeah, lots of the people who are eating a lot of food, we don't I mean, we know that they'll have acidity. The moment somebody comes to me and tells me their lifestyle, I know this person might be definitely having acidity once in a while. Secondly, if you have eaten out, if you have eaten late, then you should sleep with your head up so that your esophagus is in a slant so that the acids don't go up. These are the home measures we do where we don't require a doctor ideally. So these small measures must be taken. Like suppose if somebody has acidity, then I would tell them to drink a thin milk, because we mix water throughout the day. It should be cold. And believe me, it goes in a couple of days, the person is much better. If it is only acid and acidity or acid reflux.
Yeah. You mentioned that you should avoid tomato purees. These can lead to acidity. What other foods or beverages should be avoided?
Yeah, anything which is fried, anything which is heavy, difficult to digest, can create acidity. For example, we give them antacids. And what do the antacids do? They create environment in the stomach where the acids don't hurt you.
Get
Then
nutrition.
sometimes we give them these other medicines also where 70% of your stomach cells don't produce acid, or they do it less. In that case, what happens? If you have eaten out some meat today, because remember, whenever you eat a non-vegetarian or meat, you require more acids, right? But the stomach is already into the pH has already now changed because you have taken antacids. Then the person does not digest that meat, and then he says, I'm still unwell due to this, due to that. So lifestyle change, heavy food, non-vegetarian, this should be limited. Nothing should be stopped.
What about coffee? Because I love coffee. What about people who have coffee first thing in the morning?
Sorry, they have tea.
Coffee.
Okay, so tea and coffee, definitely the caffeine creates acid, increases the acidity. Ideally, we neutralize them by giving them something to eat with. If you're accustomed to your coffee and you cannot get up without it, definitely it's fine to have coffee. You can just not have a very large cup, maybe 3/4 cup, but if you eat something with it, maybe a toast, maybe two regal maris, maybe little nuts, then it really, really helps. Till date, I never had my tea without any snack, which can be a dry fruit, which can be anything. But although I never have acidity, but I don't create an environment in my stomach where my stomach is sitting idle and suddenly caffeine is coming from nowhere, from carbonated drinks, from your coffee. Definitely the acids are going to, take place and they will disturb your routine.
What about smoking, Geeta? Does
Yes, smoking and alcohol also lead to acidity. I mean, they increase the acidity. People who have lots of acidity should definitely stop it. But if you do everything in moderation, it's fine. It's absolutely okay. Smoking and alcohol is fine if it is in moderation.
Okay.
So what I usually tell my patients, like if they like to drink that India tea, the Karak Indian tea, they boil the tea until it's really black. That's a trigger because you're taking a lot of the caffeine. So if you want to take that, change it just to a dip tea. That's a very light, a light one.
No,
So
Dr. Varkha, but the problem is that people who love their Indian tea will never, it's my experience, not even one. They will have little, but they want their Indian tea.
the taste is definitely different.
I wish everybody could hear what we say, but this doesn't happen practically at all. Like, for example, if I tell Poonam to stop coffee, I don't know. No? So she would not like to because, we have certain habits and we are addicted. So the best way is that let them have those habits continuing, but we can tell them what else can be done.
Right.
I would recommend, like Poonam, if she loves coffee, she may, be very selective in the coffee that she chooses. A lot of times now you can use Google for this, where you can actually see which coffee has the lowest acidity. That's what you consume.
That's a very good point. Yes, to find a better coffee which is more suited to your lifestyle. I think that's a very good suggestion. Geeta and Dr. Varkha, you have both given a very clear picture of acidity on how the lifestyle manages and what is actually happening inside your body. But I can see that we have a lot of people online, and I'd like to open this up to their questions. And if anybody has a question, maybe they could raise a hand and then unmute yourself, and we can ask the question of our esteemed experts here. So if there's a question and if somebody would like to ask a question. Any questions? Or I can ask more questions. So, Geeta, my question to you is, can you give me, sometimes if you're having acidity, you mentioned milk, but any other kind of food that you can take, to a stopgap, you're out on a, outside your house, and suddenly you're feeling a lot of heartburn, what would you do?
Okay, so if you're eating out or even if you're eating home, but you have acidity,
Yeah.
the simple thing is that please have food which is less in oil. Number two, it should not be fried. Number three, when there is a difference in roti and rice, when wheat and rice, this is a very, very common, extremely common thing that, what to eat. Rice is better. It's easy to digest because of the gluten content in the wheat. Now the wheat has become bad. 20, 30 years back, the wheat was different. The quality of wheat has now dropped, and now the kind of wheat flour we are using has so many mixed things. We don't know anything about it. So rice is rice. At least I know, oh, this is my rice. There's nothing inside it. This is plain rice. But with the wheat flour, you cannot really make out. They say, okay, I'm going to have jowar, I'm going to have bajra, but they become little heavy to digest when somebody is having acidity. Remember, when you have acidity, the stomach gets sensitive.
Right.
And people like to say that, okay, we'll have this khichdi and we'll have curd. So curd should be very, very fresh.
Yeah.
It should not, the moment it is little sour, your acidity will multifoldedly increase. And then you'll have to be on these antacids. And as Dr. Varkha said, you'll go from one doctor to another to third. Nothing will happen up till and until these lifestyle changes are done. Simple potatoes, sweet potatoes, they are nice for acidity.
Right.
Now I'm not talking about diabetics. So they are nice for acidities because they don't create more acidity. In fact, they are better. They soak. So these simple foods help us. If you say, I want to have simple dal, when you have too much of lentils also, because they are little high in protein. I want to have lentils, I want to have quinoa all the time. Yes, another thing which I have seen is that people love to have their green teas because they are on a weight loss trip. They are on a wrong trip, wrong trip of weight loss. 1, 2, 3, 4, 4 green teas in a day. What are you doing? I mean, it's too much. Then they say, okay, I want to have a chamomile tea also. I want to have a mint tea also. Remember, mint aggravates. You cannot have these minty things. I hope you'll agree with me, Dr. Varkha.
Yes, plus fasting.
Yeah. So these things definitely, if you have simple food, and I would prefer the days you have a lot of acidity, stick to rice. Rice is the most non-problematic food in the world. That's why in Indonesia, like everybody's a rice eater. This is another story that it has a high glycemic index and it leads to type 2 only with people who have hereditary issues, not everyone. Rice is one of the best food. You can have whatever you want with it. Avoid non-vegetarian food. Avoid, of course, tamarind and tomatoes, these kind of things, the sauces which aggravate. Remember, these things aggravate. They don't create acidity. Acidity is only created by your lifestyle.
Right.
They only aggravate a bit. You said, oh, I had a drink today, I had 2 alcohols today and 2 glasses and acidity ho gayi. No, the basic, you should realize that the base is your wrong lifestyle. That 1 or 2 glasses of alcohol should not be blamed. Same way, one single food cannot be blamed. It is over the time you are sleeping late, you're getting up late, you're not exercising, you're obese. These are the conditions.
Yeah. We have a question, Geeta. Galaxy A50s. Yes, you've raised your hand. Please go ahead.
Yes. Good afternoon. My name is Dilip. Dr. Varkha, Dr. Geeta. My question is about burping. Yeah. So what I experience is burping, especially after having meals, and tightness in the upper part of stomach and frequent burping. So is this also due to acidity?
This is only acidity. This is only acidity. You're defining acidity only. Dr.
Yes,
Varkha, would you like to speak?
those are the symptoms of acidity.
Yes, 100%.
Yeah,
this is only acidity.
Whenever I go to the doctor, they give me the pantoprazole and Inpepsa. So I'm fed up actually of this. There is any doctor I go to give me the same pantoprazole or Inpepsa and so on. But is it GERD or it's something else? Yeah, because
You are
It
actually
is-
defining the GERD in a different way. Acidity and GERD is gastroesophageal, same. The stomach disease and acidity, they both are same. So what according to what I feel is that there is something wrong with your lifestyle. Somewhere something is wrong. That's why, in spite of going and taking all the antacids and going to all the doctors, still you're not getting better. Still you have burping and tightness of chest, is only because of some lifestyle, some food lifestyle, or maybe your activity also matters that way. That we can always see. It is only because of your lifestyle. And believe me, somewhere if you will not change your lifestyle, nothing will help you.
So the
actually,
yes. Sorry, have you seen since it's been persistent for a while, you probably would have already seen the gastroenterologist as well and done all the tests that they
correct.
recommend
I have done all the tests several times.
several times.
Endoscopy and all, but the result is always hyperacidity, and sometimes there was a wound inside.
Oh, the ulcer.
Right,
Also,
right.
yeah.
So
But
it would,
I can actually help you if you really tell me your lifestyle later. We can talk about it because something is wrong with your lifestyle, definitely.
yeah.
Actually, I'm living a
unfortunately-
very healthy lifestyle, yeah, because I very rarely eat non-vegetarian food, and I'm very, very particular about my food, and I have 1 hour of exercise every day. I do yoga. So I feel that my lifestyle is much, much better than most of the other people.
What you can do is stick to all alkaline food. The pH of your stomach might be acidic, which creates more acidity. So if you stick to alkaline foods, it definitely is going to make better thing. It will be definitely better for sure.
So maybe I can add to this. Maybe Dilip, you should meet a nutritionist and
Yeah.
Actually, this is the
explain
fact.
your diet to a nutritionist so that they can have a better understanding of your, diet and
Yeah,
your
because
lifestyle. Because
yeah,
in
it's
this, in
lifestyle.
5 minutes, nobody will be able to give you the right answer.
Right.
So, in addition to a medical doctor, maybe you should also see a nutritionist.
Right. So what I would recommend, maybe in this couple of weeks, a week or 2 weeks, you keep a food diary. You keep a log of your food, what you're eating the entire day, and what activities are you doing. Like after eating your meal, you do not want to be lying down or bending forward. So after eating a meal, you want to just, like not immediately lie down in your bed, or you don't want to bend forward. And so when you have your log of your food, you can bring that to the nutritionist, and then they can review what in your diet is the modification that you need to make. So the unfortunate part again in this era is, like most of us, like wouldn't say, like the time that we are given to see patients are very limited. We weren't, like 100 patients waiting outside. We just have to see patients in 5 minutes. Like that's the hardest part for the doctor to communicate with you on the changes that you need to do.
Right.
So yes, that's the reason why you've been, going to all the doctors and taking all the medications, but it has no resolution because there's something in your lifestyle that you need to change. So if you will keep that food diary for 2 weeks and then see a nutritionist, it would better serve and probably help solve the matter.
So very good suggestion, Dr. Varkha. I think all of us should keep a food diary to see what we eat every day, at least for 2 weeks. And that would, show us in black and white what is our food lifestyle. Yes, Geeta?
Can I ask if Dr. Geeta Seth is in Jakarta or is she abroad?
She's in Jakarta.
Okay. Then maybe I can consult Dr. Geeta.
Absolutely. After 2 weeks of the food diary.
Okay. Thank you very much.
Thank you. There's a question. There's a question on the chat. Does acidity give violent dry cough?
Yes, it does. It can, because when the acidity will cause this reflux that can go to your throat. It can cause an irritation in your throat. It can cause, like something stuck in your throat that you want to cough it out. So yes, it can.
Right. Okay, so that is the answer. Are there any other questions? Maybe you could put it in the chat, or you could raise a hand and we could, yes, Rachna, go ahead. Unmute yourself and please ask your question.
Yeah. So I also want to ask, so when after we eat, after we have our meals, we always feel bloated. Is that also the sign of that we have acidity?
It is actually because maybe your food is not correct. You're having too much of lentils or maybe soy products, which give you bloating. And of course, it is a part, it can be a part of acidity, but not really acidity always. Again, your food needs to be changed. There should be some change done in your food where you're feeling bloated. As we know, okay, if you start your day with a fruit, you say, oh, wow, I'm so healthy. I start my day with a fruit, but the moment the fruit is either raw or has more of vitamin C, it is going to give you the same bloating which it has given you. Secondly, many of us cannot digest raw foods with our lifestyle, with our age. So that also, maybe if you're having a lot of salads and you say, oh, this is really healthy for me, but ideally it does not suit a stomach. Ideally, I have seen, people love raw foods and this creates all this bloating and acidity. But let us understand, in today's era, we are not living in Himalayas that we'll have raw food and we'll enjoy our lifestyle. So please stick to cooked food and never start your day with a sweet and sour. Maybe an apple also can give you acidity if it is not very sweet. So you have to take care of these few factors and you'll be perfect.
Okay. So the bloated can be indigestion as well. So it means that your stomach is not digesting whatever you're eating.
So that's why it stays like in the upper level of the stomach, and we are feeling like we are feeling bloated like that.
That's right.
So do you think that we should, we should walk so that we digest our food, or what? Is it something to do that with that also?
We have to use certain kitchen herbs to see that the burping does not happen, and so the gases pass easily. This is one way out. And the second way is that you have to stop few foods, which we can, see what all you're eating. But stopping food is not the correct idea, because till when are you going to not eat this or that? So the best is few kitchen herbs. They really help in the flatulence, which removes the burping also, and which removes the bloatedness also.
Okay. So like something we have it after meals and all that, we have some to digest the food.
Yes.
Is it what you mean?
Yes.
And one more thing that came to my mind right now, probably the gap.
Is it some herbs to have after meals that will help?
So, Rachna, what Varkha is saying is that maybe you need to know what is the gap between your meals. Maybe you need to manage the gap between your meals to help your digestion. Okay. And maybe you could also see at more digestive kind of foods that help with digestion. And maybe a nutritionist like Geeta can suggest to you.
Or maybe not on time, or maybe what is the gap we should have between the breakfast and lunch? Like how many hours do you think, doctor?
Yes.
Very good question. Again, that's very individualized. So the food basically gets digested by 2 hours. Yeah, if your digestion system is good. Yeah, so yeah, it takes longer for some individual.
Okay, so suppose we have our breakfast at 8. So what is the ideal time for lunch we have? Like
you can have between 12 to 1.
Between 12 to 1. Okay, yeah. So that is like 4 hours, 4.5 hours.
The other thing that I'm seeing, I'm not sure, Dr. Geeta, if you're seeing the same thing, like people tend to imitate others. Like my friend eats this and has no issues. So I'm going to follow exactly the diet pattern of my friend. So that's also not ideal, because everyone is so individualized. Yeah, some, some person, like the raw food may help. With some person, the fruits may help, but it doesn't work for everybody.
Yeah, very true. So it needs to. So Rachna, again, for you, keep a food diary for 2 weeks.
2 weeks, yeah.
And
I
then
also have one more question from Dr. Geeta that, Dr. Geeta, you were saying about obese. Now, all the Indian ladies, they look obese. They have children and all their stomachs are always big. So are we obese or our stomach is big?
So anyway, obesity is one thing. Now, if you want to really differentiate, obesity is one thing, and having no acidity is one more thing. Suppose the day I have gone for shopping, and after when I'm back for 6 hours, 7 hours, I say, oh God, my stomach is burning, acidity is there because I have skipped my food, right? So there are people who go out every day. So I tell them to carry a small snack, of course, something healthy, so that every 2 hours to 3 hours they should nibble something. When I say nibble, then definitely it should be low in calories. There are so many things which are low in calories, but the moment that food enters your stomach, the acids which are already there, it neutralizes, It gets the food, it's busy digesting food, it's not going to bother your esophagus. So this is one thing. Secondly, if they say, oh, I'm obese and I'm always fat, but I don't want acidity. Yes, that can be helped. The moment you have eaten in time, that means bedtime. Your bedtime should not be, your dinner should not be after 8, ideally. And you must take a 10 to 15 minutes strolling, not a fast walking, because we don't want the blood to collect to exercise ourselves. We want all the blood flow to the stomach only. So a 10 to 15 minute strolling in the house is great, helps in acidity also. And before you sleep, take 2-3 sips of milk and water, cold milk and water. It actually neutralizes for the time being. Otherwise, if you go on and on, then there is no end. So we have a question from
Karina.
Yeah, thank you so much, Dr. Geeta.
Yeah. So Karina wants to know, does acidity give anxiety?
Yes, it does. It can trigger it. As I said, the lining of the stomach that produces acid is controlled by the hormones, which is the gastrin and the complex nervous system. So yes, it can.
There's another question which says from BK, hi there, I've got a question. So we need to avoid raw foods, acidic foods, e.g. lemon water, tomatoes all the time. Is it all the time we should avoid? Is it reversible so I can get back to eat what I eat normally? I also consume cumin powder, cumin, coriander, and fennel water. Shall that be a permanent thing? Thanks in advance.
So 100% this can be curable, and one can reverse. I mean, one can really reverse because it is just a lifestyle. It's just a lifestyle, and everything can be done well. And for example, lemon water does not create acidity. It is not acidic, Tomatoes are, but not lemon water. In fact, we are fine with lemon waters because it is alkaline. It is alkaline and it does not create any acidity. And yes, the fennel seeds and cumin, this can be topped in because you cannot overdo with them. You cannot overdo with these kitchen herbs, they are very strong also. So yes, we can definitely come back. Everything can be reversed the moment you have the good lifestyle. And as Dr. Varkha said, you maintain a diary, you will understand yourself also, and you can ask us also.
Yeah. There's another question about severe GERD vomiting from Dhanvanti Mirchandani. So she asks about that the medication has made it better, and there's also some kind of honey to cure GERD. Can the honey actually help?
No, it doesn't help. Honey does not help. Anything sugary does not help. And if you tell me you have the purest honey, first prove it to me. It's because it doesn't happen. Let's talk practical. How much honeybees produce honey, equivalent to how much honey is sold in the market, you will be amazed. You will be amazed. So no, honey does not cure. Definitely not. It's not a cure for acidity. And that's it.
And in terms of continuing the medications, no, I wouldn't go for lifetime medications, as I've mentioned earlier, because overdoing on medications can also cause complications.
Yes, it creates, it worsens the stomach lining of the esophagus as well as the stomach. And then people say that, oh, we got this endoscopy and the doctor has seen a couple of ulcers and this and that. The moment you have ulcer, you have to stop few foods. And then I mean, once an ulcer, always an ulcer, it is said, but it can be treated again. Food is diet is a very, very important factor in today's lifestyle. 50% of the problems are solved by diet. Rest, of course, not other, but 50% of your health problems can be solved by diet. This is true. So food should be used as medicine, but I think we enjoy more, including me.
So are oats recommended as a low-calorie snack? I had oats and snacks. I don't know, Geeta, what do you think?
Yeah, oats are fine. There are so many low-calorie snacks. Maybe I'll post it to you, Poonam. You can put it on the Indo-Indians. 5-6 low-calorie snacks, which you can see. Ideally, oat is not for acidity. Ideally, oat is not for acidity. It is high in definitely fiber, but oat is not recommended directly for acidity. You know, I give you 5-6 more options where 5-6 options of snacks which you will really enjoy, and they are low in calorie, and it will be good for you.
There's another question, Geeta and Dr. Varkha, I invite you to read it. It is all about taking antibiotics due to bacteria.
Sometimes I have to take antibiotic due to bacterial overgrowth, due to taking acidity medicine. Now, this is a vicious circle. You get into it, you take antibiotics, then the gut bacteria, the good gut bacteria of your stomach is finished. And then again, you have acidity. This is a vicious circle. What do you say, Dr. Varkha?
I totally agree. Yes, that's right. So
Yeah,
that's the reason, be mindful on, all the medications you have at home.
Yes. We have to stop somewhere and do few lifestyle changes. Believe me, acidity can be treated very simply and taken care of. But if not treated, it can really worsen like anything. People have come to me, do this to me. I'm having this and I'm having this and I'm having this. In 2 days, they say, oh, what is this? Because it is only lifestyle. It is only lifestyle. They want to start their day with a orange juice. Wow, that's lovely. I mean, that's really nice, but not for a person who's prone to acidity. So,
Geeta, my question is about smoothies, breakfast smoothies. There's this whole new trend about having these green smoothies in the morning where you put a green apple in it. And, what is your view on this? As a dietitian for acidity, specifically for acidity.
Should I speak?
Yes, please.
Okay. So now you're right. This is a very good question. I have so many people in Jakarta who start their day with a great green smoothie, green leaves, green apple, green everything. And wow, do you know this all raw? They are actually creating acidity. I mean, it is not the way to start your day with these green things. This is all a marketing gimmick which we all have created. No, the green smoothie can be okay for people who have not experienced and they do not experience acidity, but not in generalized, because it can create acidity. As I told you, raw foods also help in creating more acids, and at the same time, the indigestion. No, it's a wrong combination.
So what is the perfect breakfast in your opinion for people who have acidity?
Okay, let's talk about something. If you have your morning tea or coffee, you can have it along with a small snack, which is of course not non-fried, etc. And then you can have your eggs, you can have your cheese, you can have the cottage cheese, you can have a toast, you can have some oats with milk, oat with curd, with some dry fruits. These are the simplest ones. But if you want to go for little poha, upma like the Indians have, also is fine. Also is fine. But you cannot start with a green smoothie and then you take orange juice also. Then you're creating your own trouble. Right. Believe me, many people create their
detox. Own. Yeah, a lot of people do detox.
Yeah.
Nowadays.
Yes.
And what about this intermittent fasting? You spoke about obesity. Now this intermittent fasting is the next biggest trend. Everybody is fasting for 18 hours and they have a 6-hour feeding window. And that means that they are not eating anything for a long period of time. And what is this for people who are suffering from acidity? What is your view, Dr. Varkha, Dr. Geeta?
So the new trend which I'm following is that we do intermittent fasting, but we include the sleeping time also.
We include
we include the sleeping time in our intermittent fasting hours. So like you can have your dinner by 6:30, and then you can have your next morning tea or whatever by 8. So acidity and all these things does not bother you because you are sleeping also. It really has helped us. Instead of those morning to evening intermittent fasting, where people are already tensed, oh, today I have to be hungry for 12 hours, for 14 hours, for 16 hours. This already creates more acid, Dr. Varkha, in their stomach. So they are already ready for more acidity. So I use the sleeping time also in intermittent fasting, and we have good results.
Right. Dr. Varkha, your view?
Yes, I totally agree, because I would include the sleeping time as well, because your stomach, for if you do the fasting in the morning, daytime, with all the stresses that you are already going through, these stressors on its own causes the increased acid to be produced.
Right.
So it can cause more problems if there are too much things going on that produces the acid in your stomach.
So, so now I just want one more time, a validation or a confirmation of sort to say that yes, intermittent fasting is something that can be followed.
It can be followed.
Mindfully. It can be followed mindfully. Okay. And then when you're on your, when you're on your eating mode, like eating period, you need to be mindful on what you're eating as well.
Right. So it comes with a caveat that you can do this, but only if it is done mindfully with the right diet.
That's right. So not to take carbonated drinks, like you open your fast with, again, the coffee, tea, obviously, that's not mindful.
So there's a question, can Indian chai be taken twice a day or taken only once? Remember, when you take the Indian chai, we add so many things. We add the adrak, which is called ginger. Then we add cloves also. We add the green cardamom also. It becomes an antioxidant drink. Believe me, if taken properly, it becomes an antioxidant drink. And I always not tell them not to take. You can take 2 teas in a day, provided your rest of the lifestyle is great. But suppose if I tell you stop tea, but again you are doing all the mistakes and a person should not do, then again it's gone. So don't blame the Indian chai. It can be taken. It's full of antioxidants when made correctly. You should add cinnamon, you should add cloves, you should add green cardamom, and etc. etc. It becomes an antioxidant drink, and it's good for digestion also. So twice a day is okay.
Geeta, there's another question for you from Reshma on the chat.
Yeah, I can see it. The celery juice in the morning, and the next day we have turmeric with little black pepper in it. So anyway, then we can have ordinary black with a toast. Is it okay? So listen, your celery juice and your turmeric drink, etc. Please keep this between your breakfast and lunch. That 10 o'clock, 11 o'clock, when your stomach is empty and it can digest things. Because when you start your day with celery juice, of course, celery has so many vitamins, I can validate that. But what about the acidity it creates? You should not start your day with a green juice or raw juice, or again, vitamin C rich fruits. This will create further acidity. Although what you have written is great book knowledge that yes, turmeric water, this, that. If you're comfortable, again, as Dr. Varkha said, it is personalized. If it suits you, you don't mind it. But remember, it cannot suit you, most probably.
So Geeta, this thing about apple cider vinegar before meals, there's a question by Sonia Kriplani.
The first thing is that it destroys the enamel of your teeth. What are you going to do about it? So I'm not a very big fan of apple cider vinegar. I feel this is more of a marketing stunt. It's good to have your lemon water. Why do you want to, overdo all this? And they say that is coffee better with milk or black? Of course, with milk, because you have now reduced the acidity. With milk, tea or coffee is always better than the black. The black with butter, etc., does not do such wonders as they say, or it's for weight loss. It's a bullet coffee and etc.
Yes. What about bullet coffee?
No, that's what I'm coming to it. I mean, okay, adding butter and coffee only. There is no science actually. There is no such science which is proven. As I told you that this diet industry has become more of a marketing gimmick these days. So let's stick to our old thoughts only. They are always better. What do you say, Dr. Varkha?
Yes, totally agree. Totally agree.
So thank you, Geeta. Thank you, Dr. Varkha.
I have one question for Dr. Geeta, actually, which
Sure.
my patients have brought up.
Yeah.
You know, what is your thought about the ghee? You know, the sacho ghee to be taken, you know, like the half spoon, you know, to have it as a barrier for the stomach lining.
Okay, so remember one thing, the ghee and the coconut oil are medium chain triglycerides, MTC. They are actually good for your health and they do create, so many times only for constipation, I give them in the night before sleeping, that sacho ghee you said, the pure ghee,
Yes.
mixed with, if it suits them, then little milk or with little water, it actually helps. Because in any case, if not any other way, it is MTC, medium chain triglycerides. They are going to reduce your LDL. They are going to keep, and MTC means whatever fat you're eating, it turns into energy. Whereas the vegetable oils, it stores in your fat cells. This is the difference. So in any case, you're doing a win. It's a win-win situation in any case when it comes to ghee and coconut oil.
Right.
Yeah.
Yes,
They
you
have
can
seen a
always,
lot
you
of
can
progress.
always promote ghee to a limited, of course, not unlimited. You cannot fry in it because it will be too much then calories. Because believe any ghee or any oil or any vegetable oil or anything, everything 1 teaspoon is 45 calories, neither less nor more. So don't forget that you're having calories. Ghee is a great idea. It's a good idea.
Yeah. Thank you, everyone. Thank you for participating and sharing your knowledge. Thank you so much, Geeta, for your wonderful knowledge on nutrition and on diet and lifestyle. Dr. Varkha, thank you for joining and sharing this important information, which is valid for each and every one of us. Thank you so much.